Okay, good morning, class. Today we'll discuss the blood supply of the brain. Blood supply of the brain. The topic is actually blood supply of the brain and the spinal cord. But spinal cord blood supply is a very relatively short topic in your neuroanatomy book, so I guess you can touch on that on your own. So blood supply of the brain. First, let us compare the percentage of blood that the brain gets compared to your other organs. So do you know what percentage of cardiac output goes to the kidneys? Cardiac output is the amount of blood your heart can pump per unit of time. Okay, cardiac output. So the whole cardiac output, around 20 to 25% goes to the kidneys. That's about 1/4 to 1/5 of your whole cardiac output per unit of time. Amount of blood your heart can pump per unit of time. Okay? What about the muscles, the skeletal muscles? Gets about 20% at rest. So almost equal to the kidneys. Okay? During exercise, of course, you expect this to increase, but at rest, it's about 20%. What about the brain? What percentage of cardiac output actually goes to your brain? The brain, remember, the brain is one of the most metabolically demanding organs in your body. It uses up glucose, it uses up a lot of nutrients for it to function well. So it's one of the most metabolically demanding, especially for you students and for us doctors who frequently use our brains. So we only get 15 to 20%. So it's quite small. It's quite small. But you also have to remember that the brain is actually also a small organ. Okay, so let's talk about the arterial supply of the brain. Remember, when talking about the arterial supply of the brain, the arteries of the brain, you can divide this into two circulations. You have an anterior circulation and a posterior circulation. Okay? Anterior circulation, posterior circulation. And they meet at the circle of Willis. Circle of Willis. Okay? So the anterior circulation is actually provided by or supplied by the paired internal carotid arteries. Okay? Internal carotid arteries. Where does your internal carotid artery come from? From the common carotid artery. Okay? In the neck. In the neck, it is from the common carotid artery. But level of your mandible, or the angle of the mandible, it divides into a external carotid and an internal carotid. External carotid, internal carotid. External carotid supplies mostly structures in the neck. Okay? The internal carotid, however, supplies the structures in the head, in the brain. Okay, so the paired internal carotid arteries, they enter the carotid canal at the base of the skull, and they give rise to the anterior circulation. So here's a illustration. You have the common carotid. You have the common carotid here. You have the external carotid about the level of the mandible, divides into an external carotid artery and an internal carotid artery. And once it reaches the base of the skull, it enters the carotid canal, goes forward, emerges in the anterior glenoid process that covers the sinus around here. Okay. And at this point, it gives off the ophthalmic artery. So here's another illustration. Here is the internal carotid artery in the carotid canal of the temporal bone. So here it is. It gives off the ophthalmic artery, which is the first branch. And then before it goes upward. Okay? So the anterior circulation supplied by the internal carotid arteries, the right and left internal carotid arteries. Now you also have a posterior circulation. Okay? The posterior circulation, they are supplied by the paired vertebral arteries. Okay? Vertebral arteries. So you can see here, the first part of the subclavian, you have the vertebral arteries. Right and left vertebral arteries. They enter the foramen magnum and they travel upwards to form the basilar artery. Okay? From the paired vertebral arteries, they pass through the transverse foramina of the cervical vertebrae. They enter the foramen magnum at the base of the skull and form the basilar arteries. Basilar arteries. Okay? So here's another. This is a 3D reconstruction, most likely from an angiogram or a CT angiogram. So these are the paired vertebral arteries coming from the first part of the subclavian, travel to the transverse foramina, they enter the skull base and they form the basilar artery. Okay? So first, let us discuss the anterior circulation. The anterior circulation comes from the paired internal carotid arteries. Okay? Which comes from the common carotid artery in the neck. Okay, the internal carotid arteries, these are the following branches, important branches of the internal carotid arteries. So you have the ophthalmic artery, which is the first branch. You have the posterior communicating artery, the choroidal artery, anterior cerebral and middle cerebral. Okay? Anterior cerebral and middle cerebral. So the anterior circulation actually supplies most of the brain, no? Via the anterior and middle cerebral. And as you can see, it's also responsible for giving off branches to the choroid plexus. And of course, it also provides arterial blood to the eye. Okay? So the ophthalmic artery, it arises as the internal carotid emerges from the cavernous sinus. It supplies the eye and other orbital structures, and its terminal branches actually give supply to the frontal area of the scalp, the ethmoid and frontal sinuses, and the dorsum of the nose. Okay? Those branches are the supratrochlear artery, the supraorbital, you have the anterior and posterior ethmoidal arteries, and such. Okay, so supplies the eye and other orbital structures, obviously from the name ophthalmic artery, and its terminal branches gives supply to the frontal area of the scalp, the ethmoid and frontal sinuses, and the dorsum of the nose. Okay, so this is a illustration of the ophthalmic artery as it is branching off from the internal carotid. It enters the optic canal, lateral to the optic nerve. So this is the ophthalmic artery. So as you can see here, you have the medial rectus muscle. Okay, this is the eyeball. So it gives off branches here, becomes the posterior ethmoidal artery around this area. And this one is the anterior ethmoidal artery. Okay? And its terminal branches become the supratrochlear artery and supraorbital artery, which supply the frontal area of the scalp. Of course, the ethmoid and frontal sinuses via the anterior ethmoidal and posterior ethmoidal arteries. Okay? So important structures. Dorsal nasal artery is also here. So as you can surmise from this picture, epistaxis can actually be caused by branches of the ophthalmic artery. Okay? So clinical application, although it is very rare, but ophthalmic artery occlusion can occur. Usually, it causes unilateral visual loss. Okay? You have so this is rare, but prognosis is generally bad. Okay? As you can imagine, the ophthalmic artery gets blocked. You can have blindness. Retinal artery occlusion, which is a branch of the ophthalmic artery, is a true ophthalmic emergency. It's also otherwise known as CRAO, or central retinal artery occlusion, one of the only two true ophthalmic emergencies. And embolism is the most common cause. So sometimes, we, as an ENT, we actually sometimes encounter this in practice. We have some patients with AVM, or arteriovenous malformations in the head and neck, and sometimes we refer them to interventional radiology for embolization, and one of the complications of embolizing branches of the external carotid or internal carotid is it can actually dislodge the material for embolization. So there are a lot, but one of them is gel foam that they can dislodge and actually occlude one of the branches, which is the ophthalmic artery. Okay, so you have the posterior communicating artery. It's a small vessel that originates from the ICA close to its terminal bifurcation. So there is the posterior communicating artery. Okay, posterior communicating artery. And then you also have the choroidal artery. Of course, it enters the inferior horn of the lateral ventricle and ends in the choroid plexus. That is self-explanatory. Then you have the anterior cerebral artery. The anterior cerebral artery, it runs forward and medially. So as you can imagine, internal carotid, it runs forward and medially, superior to the optic nerve, and enters the longitudinal fissure of the cerebrum. Longitudinal fissure, and supply the entire medial surface of the cerebral cortex as far back as the parieto-occipital sulcus. So the entire medial surface of the cerebral cortex, all the way to the parieto-occipital sulcus. And of course, a strip of cortex about 2.5 centimeters wide of the adjoining lateral surface, or the leg area. The leg area. Okay, so this is a picture of the brain cut medially. So you have the corpus callosum here. You have so this is the parieto-occipital sulcus, about this area. Okay, and then you have the anterior here. So this is the frontal cortex, parietal cortex here. So you have the anterior cerebral artery giving blood supply to the entire medial surface as far back as the parieto-occipital sulcus. So as you can see here, this is already part of the posterior circulation. Okay, it supplies the leg area of the precentral gyrus. The precentral gyrus is the motor cortex. Okay. Occlusion of the anterior cerebral artery may produce the following symptoms, but of course it depends on the level of obstruction. If it's a more proximal branch, of course you have a wider array of signs and symptoms. If it's a more distal branch, you may only have one or two of these symptoms, or maybe a milder syndrome. So you have contralateral hemiparesis and hemisensory loss involving mainly the leg and foot. So remember, the leg area is part of is in the territory of the anterior cerebral artery blood supply. So it's in the territory of the anterior cerebral artery. Inability to identify objects correctly, apathy, and personality changes. Of course, if it involves the frontal lobe and the parietal lobe. Okay? Then you have the middle cerebral artery, so the largest branch of the internal carotid artery. So it runs laterally in the lateral cerebral sulcus. So as you can imagine, it supplies the entire lateral surface of the cerebral hemisphere, except for that narrow strip 2.5 centimeters that is in the territory of the anterior cerebral artery. So remember, anterior cerebral artery, medial surface of the brain, and that 1-inch strip, middle cerebral artery, entire lateral surface except for that strip. So this is a picture of the middle cerebral artery. Okay? The entire lateral surface here, that's the central sulcus. So as you can see here, these are the terminal branches of the middle cerebral artery. So it does not supply this small strip of area right here, which is in the territory of the anterior cerebral. And of course, as far back as the parieto-occipital sulcus, because that is already the territory of the posterior circulation. Posterior circulation. So it supplies the entire motor area except the leg area. So the occlusion of the middle cerebral artery may produce the following symptoms. But of course, as I said, it depends if it's a more proximal occlusion or a more distal one. Okay? More proximal, of course, usually it's worse, and you have a wider array of signs and symptoms. And of course, if it's a more proximal occlusion, or distal, sorry, if it's a more distal occlusion, then you will have probably milder symptoms, or a more narrow set of symptoms. So you can have contralateral hemiparesis and of course hemisensory loss, mainly the face and arm. Remember, if it's the anterior cerebral artery, mainly the leg. Okay? Mainly the leg and foot. But this one, more of the face and arm. Aphasia, if the left hemisphere is affected, rarely the right hemisphere is affected. Contralateral homonymous hemianopia, resulting from the damage to the optic radiation. And anosognosia, if the right hemisphere is affected. What is anosognosia? Anasognosia. The inability of a person to recognize his or her own illness or handicap, distinguished from denial, of course. Sometimes accompanied by asomatognosia, the denial of ownership of limbs. So anosognosia, inability of the person to recognize his or her own illness, which is not psychological in origin, okay? So this is not denial. So this is a picture of how a patient may see a homonymous hemianopia. Homonymous, they are same, so they are the same side. Hemianopia, one half, or one side only. Anopia, cannot see. Okay, so you cannot see one half of the same side. Okay, so that is how it would look like. Okay, so let's move to the posterior circulation. The posterior circulation, branch of the vertebral arteries. Okay, the vertebral artery comes from the first part of the subclavian artery in the neck. It enters the skull, again, through the foramen magnum. At the lower border of the pons, it joins the vessel of the opposite side to form the basilar artery. Okay, basilar artery comes from the first part of the subclavian, enters the foramen magnum, and at the lower border of the pons, okay, it joins the vessel of the opposite side to form the basilar artery. So it's the basilar artery because it's located at the base. Okay, so these are the important branches of the vertebral arteries. So we have meningeal branches, you have the posterior spinal and anterior spinal artery, and you also have posterior inferior cerebellar artery and pili artery. So it's formed by, so what about the basilar artery? So this is the vertebral artery. Then you have the basilar artery. So these are the branches of the basilar artery. You have the pontine arteries, the labyrinthine artery, the anterior inferior cerebellar, superior cerebellar, and posterior cerebral artery. Okay? So just to touch up on the few branches, you have the meningeal arteries. Of course, it supplies the bone and dura of the posterior cranial fossa. So remember, this is the posterior circulation, posterior cranial fossa. You have the posterior spinal, obviously, it descends on the posterior surface of the spinal cord. It arises from the vertebral arteries, or it arises directly from the vertebral arteries or the posterior inferior cerebellar artery. Okay, so you also have the anterior spinal artery. Okay, so you have the posterior inferior cerebellar artery. It's the largest branch of the vertebral artery. It supplies the inferior surface of the vermis of the cerebellum, and you have the central nuclei and other surface of the cerebellum. So mostly cerebellar, of course. Posterior inferior cerebellar artery, largest branch of the vertebral artery. It supplies the cerebellum, and it also gives branches to the medulla and the choroid plexus of the fourth ventricle. So you also have the medullary arteries, which are small branches that are distributed to the medulla. Okay, so we're done with the vertebral artery. Now you have the basilar artery branches, the pontine arteries. There are numerous small branches that enter the pons. Okay, remember, the basilar artery is formed at the lower surface of the pons, or approximately the base of the pons. Then you have the labyrinthine artery. Okay, so obviously it supplies the internal ear, the labyrinth of the internal ear. If you remember your ear microanatomy, so it is otherwise known as a labyrinth. That's why you have the labyrinthine artery. It's a long, narrow artery that accompanies the facial and the vestibulocochlear nerve in the internal acoustic hiatus, and it supplies the internal ear. It's often a branch of the anterior inferior cerebellar arteries. So here is a picture of the labyrinthine artery in approximately the internal acoustic hiatus. Okay, so sometimes we encounter patients with labyrinthine artery aneurysm, and usually these patients present with tinnitus or sometimes even Bell's palsy symptoms. Because remember, it is close to the facial artery and the the facial nerve and the vestibulocochlear nerve in the internal acoustic hiatus. Okay, so anterior inferior cerebellar artery passes posteriorly and laterally and supplies the anterior and inferior part of the cerebellum. So pretty much self-explanatory for these arteries. Their names are the areas where they supply arterial blood. So superior cerebellar artery arises close to the termination of the basilar artery. It supplies the superior part of the cerebellum and also parts of the pons, the pineal gland, and superior medullary velum. Then, lastly, you have the posterior cerebral artery. It curves backward around the midbrain and supplies the inferolateral and medial surfaces of the temporal lobe, and the lateral and medial surfaces of the occipital lobe, thus the visual cortex. So, hearing and vision supplied by the posterior cerebral artery. Choroidal arteries to the lateral and third ventricles. So it also gives choroidal branches. Occlusion of the posterior cerebral artery produces the following signs and symptoms. So contralateral homonymous hemianopia. What is homonymous hemianopia? Cannot see one half of the same side. Okay? Visual agnosia. A patient can see but cannot identify images. So imagine that. So this is how a visual agnosia will most probably look like. So if you make the patient follow a drawing, patient can follow the drawing but cannot identify the objects. So visual agnosia. Agnosia meaning knowing or knowledgeable or knowledge or learned or studied. So agnosia, not knowledgeable or not knowing. So the patient can see but does not know what he or she is seeing. So they cannot identify the object. And of course, when talking about the circulation of the brain, you have to know the circle of Willis. The circle of Willis is basically where the anterior and posterior circulation are adjoining each other. Okay, so you have 5 main arteries, of course, the internal carotid, left and right. You have the anterior cerebral artery, anterior communicating, the posterior cerebral and posterior communicating. So forms approximately a circle. It's actually a polygon because it's not really circular. So this is how it looks like. You have the paired internal carotid, the anterior cerebral, and the anterior communicating. And then you also have the posterior cerebral artery and the posterior communicating arteries. So what is the importance of the circle of Willis? It allows blood that enters either via the ICA, the internal carotid, or the vertebral arteries to be distributed to any part of both cerebral hemispheres. So it allows communication between the anterior and posterior circulation, which is important. Later on, you'll be studying some neurologic diseases, or in the clinics maybe you can see that this is important because this allows for communication between anterior and posterior circulations and possibly salvage of some parts of the brain due to collateral circulation or takeover of the anterior to some posterior parts. So you have, and then lastly, of course, you have the venous drainage of the brain. What is particular about the venous system of the brain is that they have no muscular tissue in their walls and they are valveless. Okay? So these are the venous systems of the brain. So anterior here or frontal pole, posterior or occipital pole. So you have a superior sagittal sinus, you have a transverse sinus, okay, so you have a superficial middle cerebral vein. Okay. And then this is a cut brain, cut medially. You have the corpus callosum here, you have the superior cerebral veins, draining the superior sagittal sinus. So we've already discussed venous sinuses in a previous lecture. They are formed or they are wrapped by the dural partitions. Remember when the periosteal or endosteal layer is not closely attached with the meningeal layer of the dura, you have the dural partitions. Within it are the dural venous sinuses. So they drain blood from the brain. So that is it. Please study your book. We're almost down to the last. I think this is the second to the last topic. So we will have your final exams in a couple of weeks, and I hope that you study and learn, and of course, as your teacher, as an assistant professor, what we hope is for you to learn something from our class. Thank you for listening, and good luck.